In this video, we will be discussing a low-fidelity simulator for self-training in aortic root surgery. For a little bit of background, a lot of work has been done to show that the skills acquired during simulation-based training directly transfers to skills in the operating theatre, and familiarity of techniques and more than single exposure to a specific technique can allow for improved confidence in the operating room for trainees, as well as improve the learning experience by allowing trainees to hone their skills in the theatre environment instead of having it be their first exposure. The cost associated with high-fidelity trainers and oftentimes ethical issues associated with animal tissue-based models can prevent their use in a home or training suite-based environment. All the material required to build this simulator is pictured here. A glove, both rubber as well as a latex operating theatre glove, a braided suture, a cup or a glass, a needle holder, some forceps, as well as scissors. A pen may be used as a helping tool as well. In order to create the simulator, a latex glove is placed in a glass or a cup. The latex glove is then folded over the brim of the glass and is stretched in order to form a cavity. One of the fingers of the rubber glove is then cut in order to form a tube. We then invert and then evert the tube in order to remove any folds or kinks in the tube. A pen is then used to measure the length of the tube, and then marks are made in 4 locations within the latex glove placed over the cup at the same depth as the length of the tube. The points previously made are used to guide suture placement in order to secure the base of the tube to the latex glove. The needle is passed from superficial to deep in the cavity where the location is marked. This process is then repeated for the 4 different locations, ensuring that the locations are perpendicular from each other. One of the ends of the tube is now inverted in order to provide more strength for suture anchoring. The needle is passed from outside to in and then back out at the inverted segment of the tube. This process is then repeated at all 4 sides, and then the tube is tied down. Due to the tension on the area, a slip knot is highly recommended, and around 5 to 6 knots are recommended. The other end of the tube is now inverted as well to aid suture placement. 4 further marks are made at the surface of the cavity in order to aid suture placement. These marks are recommended to be at the gaps between the sutures placed at the base in order to allow for better visualization and spread of tension. A figure of 8 suture is passed at each of the individual points. It is key to use a figure of 8 or a mattress suture in order to facilitate adequate management of the tension at each of the sites. Similarly to how the base was sutured at the top, the needle is passed from outside to in and then back out on the tube, coming out of the apex of the tube in order to facilitate better visualization. The 4 points are then tied down with slip knots as well as 7 to 8 knots in order to facilitate for better management of the tension at the sites. Further sutures may be placed in between these points in order to allow for better visualization of the interior. This is how the end result would look like. We have found that the simulator preparation can provide experience as it is likened to conduit preparation in surgery. The depth aspect and compact field allows trainees to become more familiar with ergonomic position to allow for better facilitation of movement of instruments, including needle angles for suturing within the aortic root. Of course, this simulator is not without its limitations. The material found in the rubber gloves can cause friction during suturing. It may also be difficult to simulate different angles of the aorta. However, we've found methods to mitigate this by propping the module up with objects found at home, for example, books. The color of the glove can play an impact in the visibility of sutures, therefore considerations need to be made when using darker colors. This model provides space for further development and tailoring for specific procedures trainees would like to simulate. We have found that the largest merit is the low-cost nature of the simulator, as well as the simplicity in assembly. This simulator allows for trainees to practice planning as well as spacing of sutures within the aortic annulus, as well as learn new procedures, for example, neocuspidization. The simulator can be extended upon by adding coronary ostia through enticide anastomosis of a modeling balloon or soft tube. Holes can also be made as a simulated ostia. Leaflets can also be simulated using excised segments of latex gloves. We have found that the module can be used to familiarize working across different diameters of the aortic root simply by changing the size of the rubber glove. Here's an example of a pleated mattress suture being practiced within the aortic annulus. Here's an example with leaflets as well as coronary arteries. Here's an example of a Nix procedure for aortic root enlargement being done on this model. Here's an example of a root replacement being done on the model. As you can see from 2 slides prior, coronary ostium can be added onto the model. As you can see, the model allows for coronary button reimplantation as well as the root replacement itself. Thank you for your time.